Hi everyone and welcome back to my channel A&P with Emily. Today we're going to be taking our first look into the cardiovascular system. So the cardiovascular system is all to do with our heart and all to do with our blood circulation. So the three main components of the cardiovascular system is obviously the heart muscle itself. We've got the blood vessels, so the arteries, the veins and the capillaries, and then we've got the blood as well. So there are three main components. So we've got the heart, we've got blood vessels, and we've got the blood. Now I want to take a look at the heart first. Now the heart is not just floating around by itself, it's actually contained within a fibrous sac that is very much for protection. It holds the heart in place and it's a fluid-filled cavity that allows for movement when the heart contracts. So it allows it easily to beat, otherwise we'd be a bit constrained and wouldn't work very well. We wouldn't have a very good cardiovascular system. So that sac, that fibrous sac, is called the pericardium, and that's just one of the outer layers of the heart that we're going to look at today. So the heart has three main layers. Okay, so again, still looking at the heart. Three main layers. So we've got endocardium, we've got myocardium, and we've got epicardium. Alright, let's have a look at what those mean. So the endocardium is epithelial tissue, and we all know from our last lesson that epithelial tissue, it lines things, so it lines cavities. So this lines the heart. And endocardium is epithelial tissue, okay? The myocardium is the muscular layer. Okay, and the the epicardium is the outer layer, and that's connective tissue. Okay. Now going back briefly to our terminology lesson, I just want to break up this as well. So myo, we know means muscle, and cardium, we know means heart. So heart muscle. So remember I spoke to you about the different muscle tissues that we have, and cardiac muscle was the one that was specifically in the heart. Now this is the tissue that we're talking about here, so the myocardium, which is the middle layer, the muscular layer of the heart. Okay, so we've got the endocardium, which is the inner, and it's epithelial tissue and it lines the heart. We've got the myocardium, so the cardiac muscle that the heart is made of, and then we've got the epicardium, which is the outer layer, which is also connective tissue. Ooh, everything's coming together. Everything that we've learnt so far is coming together. Now we have valves in our heart. We've got 4 valves in our heart, really. So I want to break the heart up into 4 chambers, okay? So say it goes something a little bit like this. So we've got our right atrium and our left atrium. We've got our left ventricle, and we've got our right ventricle. Okay, excuse my terrible drawing of the heart there. And your valves sit between these chambers. So these are called the chambers of the heart. So you have atriums and you have ventricles, left and right on both of them. And the valves will sit between each of them. And the valves are to prevent any backflow of blood into wherever it's just come from, okay? So these valves that we have. So let's have a look at our valves. So over on the left side of the heart, we've got this one here, which is the mitral valve, also known as the bicuspid. And on the right side, we've got the tricuspid valve. Also on the right side, we've got these semilunar valves. Now this is the pulmonary. And this one on the left side here is the aortic. Okay, and these are semilunar shaped. So if you were to look at a heart through a dissection, they look like little crescent moons. So I want to talk a little bit more about valves. So valves are made from fibrous connective tissue, and that's covered in epithelium. So we know epithelium lines everything, and they're strong. They're very, very strong. If you were to hold them up, you could probably pick up a heart just by doing that. They've got a smooth surface and they stop things from sticking to it. So any kind of bacteria or anything like that, and they have things called cordoni tendini, and that just means that they are tendinous cords, and they're very, very strong, and the purpose of those is to hold the cusps of the AV valves down. Now I've said AV valves here. AV valves stands for Atrioventricular Valves, and I know not everyone is going to be able to say that, but the atrioventricular valves are, from the last whiteboard that we saw, are the mitral valve, or the tricuspid, and the bicuspid valve. Okay, so they are what sit between the ventricles, that you will also hear them referred to as the atrioventricular valves. Okay. Now let's get into blood vessels. So the blood vessels that we have within the cardiovascular system are arteries, veins, and capillaries, and I want to go through the differences of them. So arteries and veins, they are not too dissimilar from each other, but they do have their differences. So arteries have much thicker walls. So naturally veins will have thinner ones. Now the reason for this is arteries carry oxygenated blood, and that travels at a much higher pressure. So the walls of these arteries that are carrying that oxygenated blood need to be able to withstand the pressure of that whizzing through them. And veins carry deoxygenated blood, so they need thinner walls. Even though blood through your veins travels at a faster rate, it's at a very low pressure comparatively. Okay, and capillaries are only one cell thick, so they are one cell of endothelium. Okay, and they are the most abundant, so you will have more capillaries than any other blood vessel in your body. They are much, much smaller, and their main purpose is kind of the diffusion of materials, and they act as a bridge between arteries and veins. And because they're only one cell thick, it really allows for a process called diffusion. So if we look at capillaries within our lungs or something, we've got alveoli in our lungs, and when we need oxygen to get into them, to get into our capillaries and into our bloodstream, it's a lot easier to have capillaries there than it would be arteries and veins, because it allows for diffusion. We can get that oxygen in, and we can get that carbon dioxide out as and when we need it. Now arteries and veins have three main layers. So layers, another word for layers, or that they like you to use, is tunica. Okay, tunica means layer. Now the three layers that we've got the tunica interna, also known as intima. We've got the media, and we've got the externa. Okay, so the tunica intima, or interna, is obviously the internal layer. The media is the middle and the externa is the external or outer layer. Okay, and I want to go through what these three layers are made up of. So the internal layer is endothelial cells. Sorry, camera went a bit strange there. So the tunica media is the middle layer, and it's made up of smooth muscle and elastic fibres. And then if we go on to the tunica externa, that's made mainly from collagen and sometimes binds with the tunica media's elastic fibres. Okay, so that's kind of the structure of our blood vessels. So veins and arteries will have very similar ones of these. Some layers will be thicker than others in arteries and in veins, and we're going to go into that in just a second. So if we go to the middle layer, so the tunica media, and we compare that to those arteries and veins. So this middle muscular layer with elastic fibres is a lot thicker in arteries than it is within veins. So arteries are mainly elastic fibres and veins are more so collagen than they are elastic. So this middle layer is far more beneficial to be thicker within arteries than anything else. And if we look at the tunica externa, it's a lot thinner in veins than it is, it's a lot thinner in arteries than it is veins, so it favours the veins. Now the veins, okay, so we know the structure of them, but what do they actually do? So we know the arteries, and we know we've got veins. Now I'm going to just stick with these two for the second. So arteries carry blood away from the heart to the rest of the body, and the veins carry blood from the body back to the heart. We said earlier that the capillaries are responsible for a gas exchange. So we know that the arteries have thicker walls because they carry higher pressured blood. They're lined with endothelium and they carry oxygenated blood. And the veins have thinner walls, so they have less muscle tissue and they carry blood at a lower pressure. They have valves as well to keep the blood flow in the right direction, because if we didn't have that and it was all over the place, we'd have a mess of a body, that's for sure. And they carry deoxygenated blood. Now, there are exceptions, only two exceptions. All arteries, aside from one, carry oxygenated blood, apart from the pulmonary artery, which branches off from the heart. And all veins, except, you guessed it, the pulmonary vein. Okay, so just two really important things to remember. So all arteries will carry oxygenated blood apart from the pulmonary artery, and all veins will carry deoxygenated blood apart from the pulmonary vein. I think that about wraps up the anatomy of the heart anyway. So we've covered the heart and the different the different layers of it and the different chambers, and we've covered what three blood vessels that we have within the cardiovascular system and what their functions are and what they do, and the structure of them as well. Next lesson we're going to be going on to obviously still the cardiovascular system, but we'll be looking at the circuit of what happens and when those valves open and what we can hear when those valves open and close, all through a stethoscope and stuff. Okay, so that's what we're going to do next lesson, and from Kenny and myself, who's looking a little more festive than last time, because that time of year is coming around again. But feel free to like and subscribe and share this to as many people as you see fit, and we'll see you next time. Take care.